3 potato, 4. 5 potatoes, 6 potatoes, 7 potato more. From understanding numbers at an early age to the role they play as we get older. Our next speaker has some insights to share. Miss Annette.
Would you like to say something? 10 years ago, how many cell phone numbers or phone numbers could you recite off the top of your head? A lot, right? 10 years ago. But what about today? Not so much. Our Orphic cell phones and iPhones have taken over. But I would bet that you still know your mother's phone number, your family's phone number, and your friend's phone numbers. Numbers that are important to us, we remember. Numbers are all around us. Cell phone numbers, social security numbers, PIN numbers, access codes, security numbers. How many numbers do we have? We live our lives around numbers. I can recite credit card numbers. Can you recite your credit card numbers?
Whoa.
It always alarms my husband. Just a little. For my speech today, I would like for you to form a little foursome where you're sitting. Look to the person in front of you and on each side. It may not work out perfectly, but just for illustrative purposes, stay where you are. Just think about this foursome. Because I have some sobering statistics about your foursome. According to the American Heart Association, 2 of you will have hypertension, and 2 of you will have diabetes. In your foursome, 1 of you will develop and die from cardiovascular disease. Every 20 seconds in this country, someone has a heart attack. Every 33 seconds, someone actually dies from a heart attack. Very sobering numbers to consider. So my goal today is to teach you 3 very important numbers to remember. Just 3 that directly relate to cardiovascular disease, the #1 killer of men and women in this country. 3 little numbers: your blood pressure, your cholesterol, and surprisingly, your waist size. All of the information I'm going to share with you today, I'm going to pass out. So don't take notes, I'll have it on for you. Let's start with blood pressure. Someone tell me, what's a normal blood pressure?
120/70.
Very good. 120/80 or below, so perfect. 120/80. The top number is your systolic, the bottom number is your diastolic. The top number represents the amount of pressure that your heart has to pump to get blood throughout your system. The bottom number represents the pressure that your heart exerts actually at rest in between beats when it's filling with blood. The amount of work that your heart has to do to get out into the system exponentially increases when your blood pressure is just a little bit raised. And if it is slightly above normal, you are considered pre-hypertensive, and you might consider modifying some of your behaviors to get that in check. If your blood pressure is 140/90, you are considered hypertensive, and you will need to be on medication. As adults, we all need to be responsible for our blood pressure. You need to know what that number is. And in the packet I'm going to give you, there's a card that you can actually put in your wallet. And every time you get your blood pressure checked, jot it down, take it to your doctor. He will want to see the trend. In blood pressure, it's not about just one number, it's about the trend of blood pressure. And there are machines everywhere. You can go to Publix, you can go to Walgreens, you can go to the Y. They have blood pressure checks all the time. You need to start going and looking into that. And in your foursome, 2 of you have hypertension. Let's move on to cholesterol. You've heard me talk about cholesterol and fat. I'm not favorite subjects. Cholesterol is one of the best indicators of heart disease. And cholesterol is okay. It's just when it starts rising and getting out of control that we need to be concerned. So at a normal screening, your physician will order lab work, and he'll look for 4 things: total cholesterol, HDLs, LDLs, and triglycerides. Anyone know what a normal total cholesterol should be?
160.
That's a good guess. About 200. So anything below 200 is perfect. LDLs are those bad cholesterols that are in your blood system and they stick to artery walls, causing plaque and buildup. That level should be under 100 to be normal. HDLs are those good cholesterols, like pectin. They go and eat up the bad cholesterol and get rid of them. That number needs to be above 50. And your triglycerides are an indication of how your body processes fat. And that needs to be under 150. But the key number we always look at is that LDL. That is the best predictive indicator for heart disease. In your foursome, someone has high cholesterol right now and they probably don't even know it. Very, very sobering numbers. So let's move on to the next one, waist size. That's a little bit new in the cardiovascular predictive area. But there have been several studies, and the most recent one is from the Journal of American Clinical Nutrition. And they watched 27,000 men over 13 years and found that if your waist size is over 40 inches, those men were at 12 times a higher risk to develop heart disease and diabetes. So those waist sizes you need to know. Women, we're not out of the woods. Our waist size has to be at 35 inches or less, or we are in the same boat. There is one other calculation that you used with waist size, and that's a BMI. It's called Body Mass Index. And you can measure that through waist calculations, actually use a height-weight correlation. And in the packet that I'm going to give you, there is a calculation in there. So when you get home, you and your spouse can measure each other's BMI and see how it looks. I'm also giving you the normal ranges in this information I'm going to pass out. If you are at 25 inches, you're good. 25 to 29 means you're overweight. If you're over 30 inches, the score will indicate that you are obese. And in your foursome, there's probably 2 of you that are overweight or potentially in the obese category. What do we need to do to control those 3 numbers? Our blood pressure, our cholesterol, and our waist size. Well, it's lifestyle modifications. We all know that. But what I want you to remember today is it's all about your back. It's all about your back. Back away from the salt. Back away from the table. Throw away those cigarettes, please. And get back to exercise.